Hi, I'm Susan Bonilla, the CEO for the California Pharmacists Association. I invite you to enjoy this interview by Assembly Member Aguiar of one of our CPHA members, Dr. Marilyn Stebbins. They discuss the need for California pharmacists to be involved in the COVID-19 testing. Thank you.
I represent the rural communities. I have 5 counties. And so one of my initial things we ever did, Dr. Stebbins, is that I took my whole entire team out to go see what it's like in rural California. And we all came back with a whole different sense of what's important. And the number one word that came up all along was access, right? Healthcare.
Absolutely.
Education, job creation. And so when this whole pandemic came down, my first thought was, how do we help people? And how do we understand their story? And how do I work with my constituents so that when we face these disasters, how do we do a better job? And how does the system do a better job?
One of my biggest frustrations was testing, and not early on, because I didn't even think there was a possibility of having COVID. I thought I had a flu because I was so early. But now it's incredibly frustrating for people to feel like they have a symptom and be unable to get tested, and just to be told, please go home and self-isolate for 14 days is a non-answer. I mean,
Right.
it's really what we had to deal with because we had a lack of testing. But now that we're seeing more available testing, I know in Yolo County, we now have Woodland doing testing through May, and through June will be West Sacramento.
Right.
And that testing is available to anyone.
Right.
And so no longer do you need that physician order, and you don't even need to have the symptoms, because that's the surveillance that we need.
Mm-hmm.
Now, how do we get that to our rural communities? I feel as though that's the key. Mm-hmm. And as a pharmacist, I have to say I'm incredibly frustrated with the California Department of Public Health in their interpretation of our state law, not allowing pharmacists who are within 5 miles of any person,
Right.
in the country, and is a ready workforce to test.
Right.
We do testing already in pharmacies. We give vaccinations.
Right.
We're healthcare providers. Patients know us. The community knows us. You don't have to set up a tent with people you don't know. We have a pharmacist in every community that could be doing this surveillance testing, whether it be the serological finger sticks or whether it be the swabbing for the asymptomatic positives or people who are positive. And the fact that that isn't being allowed, is really frustrating. And on the other hand, the governor is developing a whole new workforce to go out and do this.
When we already have a workforce.
We have a workforce, and a very, very educated workforce that
Right.
can also talk about it, can talk about the disease, can talk about, the misinformation in treatment, what's correct and what isn't. And, many people say, but I don't want to be walking through a pharmacy if there's sick people coming in and out. Well, guess what? There's drive-up testing everywhere.
Right.
You don't have to do testing within the pharmacy. You can do it out in the parking lot.
Right.
I've been tested now 8 times.
Yeah.
And the last 5 times have been outside.
Yeah.
So there's not a problem, but we really need to get this going so that we can open up. But we can't safely open up without this information. And if we do, I fear we're going to shut down again, and we'll shut down in a restrictive manner.
Right. You just enlightened me, because it just makes so much sense, is to use our already trained workforce that's out there to use this. And that is a good question that I'd be more than happy to put forward.
Thank you.